Good morning, everybody. My name is Terrell Odom. I'm the Associate Director in the Office for Military Affiliated Communities, which is located in the Office of the Provost's Equal Opportunity Programs. OMAC serves as a central hub of resources, support, and programming at UChicago for veterans, service members, and their families. I'm honored to introduce the university's fourth day of Vet Week, the LGBTQIA plus, and the veteran identity. As a U.S. veteran who has served this nation honorably, it's my duty to ensure that all veterans and service members receive their due recognition for their sacrifices and service to this great nation. I grew up in a military that was not open or considerate of the experiences of our heroes who openly identified with the LGBTQ community. Quite contrary and hypocritical, I think, you could openly put your life on the line for your country. You could openly serve as a straight male or female, but you couldn't openly love whom you wanted. As a former medical professional in the military, I've seen firsthand the exclusionary practices, policies, and demeanor towards a group of individuals who wanted nothing but to serve their nation honorably and with dignity. I would like to introduce you to today's MC, Morgan Landers. Morgan is an iHouse Fellow, Graduate Fellow at the International House, U.S. Army veteran, and first year at the Harris School of Public Policy. Please join me in welcoming Morgan Landers.
Hello and good morning, everyone. I'm glad to see all of you here. As Mr. Odom said, my name is Morgan Landers. I'm a first-year graduate student at the Harris School of Public Policy, and I'm also a proud member of the United States Military Class of 2018, which we lead, as well as being an International House Graduate Fellow. I want to start by thanking the members of the Equal Opportunity Programs Office for Military Affiliated Communities. They've worked tirelessly to create meaningful programming and services for the military affiliated community at UChicago. While I've not only been here for a short time, OMAC has provided me with the opportunity to find myself rooted in an engaging community of veterans at UChicago that have helped me in every facet of my transition to civilian life as well as to academic life. And its level of assistance, Mr. Odom and the others that have helped me, they only know. But I also thank them for allowing me the opportunity to be engaged with the community of OMAC, including the opportunity to serve as today's MC. OMAC has expanded opportunities for the university community to recognize, learn about, and support the military affiliated community, in addition to organizing an annual Memorial Day program and Veterans Day recognition programs. OMAC has partnered with the School of Social Service Administration to highlight service-connected injuries and their impact on the lives of veterans, the International House to bring students and scholars into a global community, the law school and law school veterans to bring awareness to our female veterans, and the Honorable Senator Tammy Duckworth's office, Green Card Veterans and UChicago faculty to bring awareness to the U.S. veterans who are deployed from the United States. As a U.S. veteran who has served this nation honorably, I also feel it is my duty to ensure that all veterans receive their due recognition for their services and sacrifices to this great nation. Unlike Mr. Odom, I entered the military in a time of transition. Don't ask, don't tell had ended at that point in time. And I was shocked to hear stories from my fellow service members about being marginalized while putting their lives on the line for this country. People that I entered the academy with, as well as people with whom I had served, had their own tales of dealing with the ramifications of this discriminatory policy. And while I did not bear witness to these exclusionary practices firsthand, their memory lives on through the fellow service members' experiences. So in introducing our panel, first I'll begin with Kristen Beck, a 20-year veteran of the U.S. Navy and SEAL operator. She completed tours in Afghanistan, Iraq, Bosnia, among other places, and received numerous medals, including a Bronze Star and Purple Heart, and 27 other medals. For those of us not familiar with the SEALs, they are arguably the world's most elite fighting force, seeking out and destroying enemy combatants via the sea, air, land, and sea. Kristen has also shown that all service members, regardless of identity, are fully capable and willing to serve in the armed forces with honor and distinction. Before we get into today's panel discussion, I would also like to introduce Brad Grams. Brad is a U Chicago alum and leader of the university's LGBT network. The network serves as a resource for current and former U Chicago students who support and identify with the LGBT community. And with that, I will hand it over to Brad, and I thank you for providing me this opportunity to MC.
Thanks so much, Morgan. Hi, everyone. As Morgan mentioned, I'm Brad Grams, U Chicago College class of 2005. I'm representing the university's LGBTQ plus affinity group steering committee. Thanks so much for having me at today's LGBTQIA plus and the Veteran Identity event. It's really an honor to be here with all of you and supporting this programming, which is more important now than ever, given our current situations. I just wanted to let people know, some of you may know, being involved alumni, that the University of Chicago is in the process of reconstituting its LGBTQ plus affinity group, which had actually been inactive since about 2017. So as part of that effort, we really wanted to reach out to all of you on this call to engage you in our efforts to restart operations, re-engage LGBTQ plus alumni, and also just build a broader and stronger alumni community at the university in this regard. Personally, I wasn't even aware that the LGBTQ group was inactive till I moved from Chicago to DC in 2017. I was getting involved in the alumni group in DC, and I discovered that the LGBT group had been inactive. So over the past year, I've been working to reactivate it. And we found that especially in these times, our student and alumni community may need more support than ever before. So if, like me, you're looking to meet other LGBTQ plus alum and support other students in the school while giving back to the broader community, we'd really love to have you, and it's a great opportunity to get back. We're going to have many opportunities for engagement in the weeks and months to come, from event planning to communications to developing our board and committees, as well as just mentoring and helping people explore their careers and expand their lives further. And we'd love to have you join us as we develop this work. And if you're looking to get involved, whether it's in mentoring or events or just getting associated with other groups beyond the veterans group, we have bi-weekly affinity group coordination calls across all of our groups, from the Latinx to the Black alumni to the LGBT plus to the women's groups. And we also have bi-weekly LGBTQ plus specific calls where we'll be working on this programming. So if you're interested in getting involved, feel free to write me back at your convenience. I'm available at bgrams@gmail.com. That's B as in boy, GRAM as in Mary S @gmail.com. We'd love to have you on board, and feel free to outreach this information to your friends and colleagues. The more people we can get involved, the better. And just as a point, since this is the veterans call, apart from my work with the LGBTQ plus work, I'm also really involved in mentoring veterans transitioning to civil service, particularly federal, state, and local governments. So I'm doing that work on behalf of the university, as well as with the U.S. Environmental Protection Agency and the U.S. Treasury's Executive Institute. So if there are people involved in doing more mentoring, job coaching, job transition support, definitely feel free to reach out as well. And with that, Morgan and Terrell, I'll turn it over to you for questions, feedback.
Thank you very much, Brad. I appreciate that information and input, and for soliciting all of us to get involved. I would now like to introduce you to Ms. Maris Garcia, who is the director of the U Chicago Diversity and Inclusion Studio. Using a human-centered design approach, she coaches partners in making the campus more equitable for underrepresented students, staff, and faculty members.
All right. Hi, everybody. I'm gonna share my screen. All right. Thank you so much for having me here. As you said, my name is Maris Garcia. I am here from the D&I studio, and let's jump in. At the studio, we are connected to the Office of the Provost, and what we do is we engage with partners across the university to create a more inclusive campus using human-centered design methods and values. And for anyone not familiar with human-centered design, it's really a creative problem-solving process that incorporates research, strategy, and design to create new opportunities. And so we do this on campus in two key ways. The first thing that we do is we create tools to assist campus-wide diversity and inclusion efforts. So this might look a little familiar to some of you. This is a D&I planning toolkit that came out about 1.5 years ago. And this was really a guide for leaders on campus that had a framework for how to approach diversity and inclusion, and then tactics and resources for how to go about enacting things to improve diversity and inclusion. But this was really, again, a general campus-wide effort to get everybody moving and doing something to improve diversity and inclusion. There's a new version of this coming out soon, so keep a lookout for that. But in addition to creating, tools for campus-wide efforts, we also really focus on coaching offices who are serving underrepresented UChicago community members to better understand the needs of these members and identify new opportunities for them. And so this is an image from work we did with OMAC. I think last April, we were just saying we started this work, and I guess a year ago in April. And I remember when we did this work and we connected with Terrell, it was soon after he got to the university, and Terrell had said, I can do anything for these students. Okay, he said, I can do anything. I just need to know what it is that they need and what would be helpful. And so that's where we started the work together. So we connected with 8 military affiliated students across campus who came from different places in the military and who were working really in all different schools on campus. And we did interviews with them and learned a lot of different things about their unique experiences. But what we learned from all those different interviews was that all of their needs really mapped to these 5 key, what we call facets of wellness. And these were social, emotional, financial, intellectual, and occupational wellness. And these are not, these different dimensions are not things, this is not a framework that we made up. There's actually a Facets of Wellness framework that some of you may be familiar with. They actually use it in student counseling services here, but it's just a helpful way to organize people's needs. And so what we did based on the research is that we saw, okay, how do these things impact students on campus? We identified social wellness. This is about feeling understood, building relationships, and experiencing a sense of belonging. And what we learned from our research was there's this myth, you may know this, that veterans are all the same: white, straight, Christian, conservative men. That may seem funny to people who are part of this conversation, but that is something that people, some people do believe. And what we know is that it actually isn't true. Especially from our research, we learned that military affiliated students are diverse in their backgrounds, experiences, and their service. And from our interviews, we heard that because not all people know this, that was impacting students' experience, and that was challenging their sense of belonging and their ability to connect with people on campus. And so in this instance, and for all the other dimensions of wellness, we took the research and the data that we had, and then we shared that out with the team in a much longer presentation than this. But then we brought each of those different facets of wellness down to what we call how might we questions, these opportunity areas to say, okay, now that we know this, what can we actually do about it? And so in this case, we said, okay, how might we educate UChicago civilians about the diversity of military experiences? And how might we create an atmosphere where military affiliated students can fully participate regardless of how they identify, regardless of their background, regardless of anything? We want people to be on this campus to really be able to bring their full selves. How can we help them do that? How might we build connections and camaraderie for military affiliated students across units? And then how do we set up UChicago military families for success? We know that that's something very different for military students than for other students on campuses. They're often coming to campus with partners and with sometimes even children. And so I'm not going to walk through all these different dimensions, but this just is to give you a sense of the things that we were looking at. We said, there was emotional wellness, which was understanding your own feelings, expressing emotions in a constructive way, and managing stress and mental health. We covered financial wellness, which was a big topic at the university for students trying to figure out how to pay for this education, making informed financial decisions, managing expenses, and maximizing available resources. We heard about intellectual wellness, engaging in critical thinking, expanding your knowledge, and imparting your knowledge to others. Very not surprising that this was a big need at the University of Chicago. And finally, occupational wellness, which was all about finding fulfillment from your work, contributing meaningfully, and continuing to expand your skills and strengths. And so when we did this work, we shared out all of this information to a great group of people, combined from people from from OMAC and from other offices on campus, from career advancements, from counseling services, and from students as well, and got their feedback on this and how this related to their own experiences. And then we connected back with the OMAC team and said, okay, now that we know all of these things, what makes sense to start with? Where do we go? What kind of programs make sense to bring to life to support the students here? And you guys may see on the photo here, there's a board that says financial in the corner. I think the one next to it said social. We thought it made sense to focus on 2 areas out of the 5 to get started. But then soon after this, I remember catching up with Terrell and saying, hey, how are those 2 areas going? And he said, oh, it wasn't just about the 2 areas. We really had to focus on everything. And so if you're connected to this office and to Terrell, you know that there's no stopping and there's a lot happening in the office. And so just want to show you a little bit how these different facets of wellness are showing up in the work. Some of you may have participated in this symposium just a couple weeks ago. And really those speakers in the breakout groups were covering these different topics. As we mentioned earlier, there was financial wellness was a big part of this work. And so Terrell is often meeting with people around campus and students to educate them on what their options are and encouraging people to support students financially coming from the military. There's groups like Posse and PAVE that are, again, addressing all of these different facets of wellness. And finally, there's this event here today, which is also here to get us to talk about these different things and address social, emotional, and intellectual wellness. And that's it. Thank you for your time and your service. And it was just an honor to participate in this work and to be here today.
And thank you as well, Maris. Your work is essential to building a better, more inclusive community for both civilians and military personnel. And we all thank you for that.
Thank you.
So turning to today's program, our panel discussion features our moderator, Vicki Sides, Director of Education and Outreach Equal Opportunity Programs, and our panelist, Dr. Benjamin Bowman, U.S. Army veteran and medical resident at UChicago Medicine. Without further ado, please join us to welcoming our panelists and our moderator.
Hello, everyone. It's really wonderful to be here. It's wonderful to be here in conversation with Dr. Bowman. And I appreciate the opportunity to, use part of this week to honor our veterans. I myself am not a veteran, but I come from a military family. And I've learned so much about working with veterans and the veteran community just in the time that I have the opportunity to work with Terrell. So thank you for that, Terrell. And with Dr. Bowman, we will get started with our questions. I'm going to first ask you to introduce yourself to the group and to say what it is that you do here at the university, and then we'll get started with our questions.
Great, yeah. My first name is Ben, Benjamin Bowman. You can call me Dr. Bowman, but Ben's great. So I was previously a medical student at the Pritzker School of Medicine here at University of Chicago, and now I'm an emergency medicine resident. So that primarily entails seeing patients in our emergency room here in Hyde Park, as well as the pediatric emergency room that's located just a block away, as well as patients at the University of Chicago affiliate hospital, Evanston Hospital, which is on the north side of the city. However, I do, as part of our training, work in the medical ICU, the surgical ICU, the cardiac ICU, as well as the pediatric ICU. So, which during these times can be very trying, but it's also very rewarding. And I have a lot of the same feelings I had about serving in the military for serving our community.
Absolutely, thank you. So turning to a discussion of your military service, we know that the military is extremely unique because of its ability to provide different kinds of opportunities to people, right? There's a wide variety of opportunities that people have in terms of choosing what profession they will ultimately be a part of. So can you start by telling us why you chose to join the military, what your job assignment was there, and how, if at all, that's connected to your work as a physician now?
First of all, too, I want to say, I forgot to say how honored I am to be here, sharing my experience with everybody, and how thankful I am for the supportive, community and the service that, so many of the veterans on the call, have carried out, and as well all the other people who support us and the other students in the community. So as far as my journey to the military, I think a lot of you guys know that it's a social elevator. So my family, growing up in Western Colorado, did not have a lot of the finances necessary to send me to college, and my parents were preparing me early to take advantage of the benefits that social elevator can provide. So my mom had previously worked at a recruiting station, and so I was well acquainted with members of the military, and I think maybe early on was disabusing myself of some of the biases of what those people, who they were and what they meant to our country, and who they were as people. So I think I was much more open-minded to that option. And so right out of high school, I joined the military. I knew kind of what I wanted to do based on the conversations with my mom, who had worked closely there as a secretary at the recruiting station. So I knew I wanted to be a Chinese linguist. And I took the defense language aptitude battery test that showed it would hopefully be able to learn Chinese, which I did do eventually. And then from there, I was stationed I did basic training in Missouri, stationed in Hawaii, and in California, Texas, for that job. And then later on, I realized that I wanted to work overseas. I had a strong interest in foreign languages. And so I applied to the Defense Attaché System, which is the Department of Defense's core of military diplomats. And in that system, I was fortunate to be able to learn French in Washington, D.C., and then I was assigned for 3 years to West Africa, to the country of Mali, which some of you may have heard of recently. They had a coup, but that's also where Timbuktu is located. And our job there was to liaise with the host nation military, the United Nations forces that were there, and carry out humanitarian as well as counterterrorism operations. And I found it really fulfilling. I was in the military from 2000 to 2009 as an enlisted, and I was discharged as a sergeant first class. And then I just recently rejoined the reserves as a captain, as an emergency medical physician. So hopefully I'll be able to pay it forward again.
Excellent. Excellent. Thank you. Speaking of a wide variety of experiences, right? So I love that you referred to the military as the social elevator. I know instinctively that that's how people think of it, but I don't think that I've ever heard that term before. And so it does give you a lot of opportunities to see the world, right? And to try different professional
and meet lots of new people too.
Yes. Which of course broadens your perspective. So even if you don't necessarily have that sort of breadth of vision about humanity and about people going into the military, then hopefully you gain that perspective there and bring it with you when you come out. So shifting to our next set of questions, it sounds like your dates of service straddled the Don't Ask, Don't Tell era into when that was repealed. So can you talk about what it felt like being active in the military before and then post Don't Ask, Don't Tell?
Yeah. So first, I kind of have to acknowledge my privilege as, a white man and as a cis male. I think for me, my experience is probably very different than many other people. So both before and after, I think I just have to, acknowledge that probably made my experience very different than a lot of other people. So before Don't Ask, Don't Tell, I frankly didn't feel comfortable being open about myself, and to avoid bias and then being expelled from the military. I always kept my sexuality a secret. And I did that because when I was in training in California, learning Chinese, there were about 9 Arabic linguists, and I think this was 2001, 2002, who were all expelled from the military at that time. Some of them towards the end of their year and a half training to learn Arabic. This was right after September 11th, when their skills would have been highly valuable. And so I never really felt comfortable doing that. And so that was then. And then in this post period, it's interesting now that I'm married and an officer, I feel a lot less of that stigma. And that's, I think, a huge change that not only that I admire, but that I felt at the time in 2000, 2004, I never really thought would happen. And so to me, that's I think a big step forward for our country.
Yeah, thank you. It sounds like one of your strategies for staying physically and mentally safe had to do with just not talking about your gay identity, the gay part of your identity, right? And so I'm wondering if, even if not for yourself, did you observe how others stayed physically and mentally safe? Was it just a practice that people just didn't talk about it?
Yeah, so I think there were a couple methods. One that I also employed was distancing myself. We talked about making connections with people, and sort of closing yourself off was a way to protect yourself, but also sort of, I think, affected unit cohesion and the sort of the strong connections you can make with your your teammates and your friends. Actually, I think at that time the online was becoming a new place where people could seek out solace and see, okay, there's another soldier in this part of the country who's experiencing the same thing. And frankly, I did see, my fellow trainees and fellow service members reaching out to each other for community, never to official resources out of fear, of being dishonorably discharged, but they would get together. But then I think people became very fearful of that after witnessing a group of people who had gotten together, all being caught and then all dishonorably discharged from the military. So it was really unfortunate in that the resources that we would all traditionally go to, our social support networks, were sort of the last place you could go. But thankfully at that time, the internet was, in its, early stages. And so I think some people found solace there. I didn't at the time. I found it from distancing myself actually from that social support network, but which is unfortunate, but different now, I think, in some respects.
Yeah, and that's a very important point. And I think I want to highlight again the point between when the policy changed and when the practice actually was able to change. I think those of us who've been around for other social movements have seen, for example, school desegregation, the law changed, and it takes society a good number of years, some would say still, to catch up to it, right? And so when Don't Ask, Don't Tell was lifted, it was still probably, it sounds like a very fearful thing to be open about who you were. Okay, not you specifically, but people, in the military in general. All right. So you talked about not really having a group within the military where you could, get support around a shared identity, but that because the internet was sort of newly emerging as a space to do that, that some people found that as a space, but you didn't. Were there any other strategies that you had? Connection to people back home, through letter writing? What was there anything that any way that you did get support?
So I think fortunately the military, at that time, especially sexual identity notwithstanding, definitely demonstrated a strong sort of esprit de corps. So I could still find, solace and support in my team members without sort of discussing those issues, which is helpful. I think, having, friends who are, deploying in the same way, or who are, maybe going through similar financial issues or struggling with, professional issues. So the being able to reach out directly was also helpful at that time, but like I said, there were no sort of medical or administrative places you could go for those things. And so, you mentioned sort of letter writing, and I think maintaining strong family connections, even though there was that distance, still not being open to my family at that time too, for fear that, interactions or something would, get back to my unit and then, perhaps be discharged. And so, and I'm so happy that now I feel like I don't really have to worry about those things as much. But yeah, I think family support was very important. And my fellow service members, I'm not saying at all were not supportive, but it's just that, we never would be talking about sexual identity. So you could be as supported as possible in other ways, but there was always sort of that one sort of, I think closet is a good word, but there was always this one issue in the back that you could always, you could sort of beef up your support in other ways, but you'd always be thinking about that one thing and be fearful of that, which I think is not a great way to have, cohesive functioning teams at all. I'm sure a lot of, have seen that in other ways.
Yeah.
Great question.
You have a high level of awareness, I would say, of the fact that you hold both privileged and marginalized identities. And I'm wondering, I'm going to speak to a specific marginalized identity that you don't have, but that you may have seen, which is our transgender siblings in the military. A lot of people talk about the LGBT community, and they really leave out the T, right? Like you really don't focus on the T. And so we know that there was a transgender, the transgender military ban was lifted in 2016. A new administration came in and sort of reinstated it, but not legally, but in terms of practice, it's very much instated. And so I'm wondering what your thoughts are on the transgender military ban.
So I'm very much against the ban. So I'll just go ahead and say that outright. I have a lot of reasons that I think that. I think the first one is that there are not a lot of supporting arguments for it that are rational and evidence-based. I think there are 18 countries in the world that allow transgender citizens to serve in their military, including Israel, the United Kingdom, and Canada. And those countries don't have negative experiences. They don't have effects on unit cohesion. In fact, the argument could be made, and I think I've sort of hinted to it, that units are more cohesive when their service members can be open with each other and closer. Also, before the ban was lifted, there was a big study that was done by the Department of Defense. I don't know if you guys remember that from CNN, but at the time it was pretty astounding that 50% of service members supported the lifting of the ban, and that 72% of people wanted to see transgender citizens be able to serve in the military. So that's just one argument for it. I think a second one that's really important is there's just no evidence for transgender identity being pathologic in the way some people have said it is. Our understanding now of sexual identity has changed a lot. With gay and lesbian identity, it was taken out of the psychiatric manual that lists all the pathologies and their treatments, many decades ago. And transgender is following the same path. It's not fully there, but it's following that same path. So I think as our understanding evolves, that's going to be a second argument for it. Also, some people make this argument that transgender service members are maybe more prone to depression or other mental health issues. They're even if you don't consider their transgender identity itself as pathologic. And I think it's easy to conflate perhaps those the higher incidence of depression and other mental health issues among transgender service members with the fact that they're not able to, openly express themselves and their identity, perhaps being, a community that's, underserved and suppressed leads to those issues as opposed to, the identity itself leading to that. I'm trying to think what else, other things that, some people have said that transgender service members incur higher medical costs, and that's a reason that they shouldn't be able to serve in the military and definitely not openly. And I think that's kind of a flawed argument too, in that, we don't exclude women from military service because they could incur the costs of pregnancy, and we don't exclude families because, it would cost more to support military families. I think there are a lot of flawed arguments when it comes to transgender identity and the ban. And finally, if the United States wants to be a leader in the world on human rights, we have to be a country that kind of walks the walk. Mm-hmm. And so, just when I think about that ban, all of those things come to mind immediately. And I can't think of any rational or evidence-based arguments for keeping it.
Yeah, that is an excellent answer. Thank you. And particularly excellent in light of the fact that the very argument that they're using for keeping or for, initiating the ban and keeping it is that they believe that there's a gender identity dysphoria that they're saying. So they're saying it's not about them being transgender, it's about the dysphoria of gender that they have. So it is very pathologizing, that argument is. So thank you for that. All right, so in talking to LGBT identified service persons, one of the things that I've heard quite often and read about quite often is because of the stigma, because of the sort of environment that doesn't allow them to live into and be open about who they are. One of the coping strategies that many turn to is substance abuse, right? And so I'm just wondering if in your time in the military, you saw that and sort of what toll it took, but also in your time since leaving the military and working in an emergency room environment in particular, if you see that, and if you do, what advice do you offer to the people who might be experiencing that?
Absolutely. I saw it both when I was in the military, and I still see it. Thankfully, I don't see it every day, but I've seen it both as a physician in our emergency department and as a patient at the VA myself. Just seeing, talking to fellow patients in the waiting room. So I think some of the key strategies for combating it that unfortunately I don't think I really was able to do when I was enlisted before during Don't Ask, Don't Tell is trying to reduce stigma and achieve policy change. And a lot of people were scared to help their fellow soldiers with substance use disorders for fear that, they were, the social connections would be found out and then, they would be dishonorably discharged. Now, though, as a physician, I think I have an opportunity, and like a place that we as physicians can intervene is when people are having acute crises. Substance use disorders shouldn't be, in my opinion, pathologized. They're like headaches, they're like chest pain. There are reasons people, can become victims of them. And so I think being there for them in their acute crises and making sure that people are aware where they can go, whether it's their emergency room or their primary care doctor. And I see a lot of veterans, when they come and we help prevent them from having an acute crisis that leads to medical complications. So that's one role. And then once we can get people stabilized, if they don't need discharge, I think something that I really like to do is get people connected with resources in the community, whether that be a physician or a treatment group or therapy. And it really isn't limited to alcohol either. A lot of people think that, it's, veterans are, sort of like we had talked about earlier, there's a stereotype of a veteran, and then, it's this, cis white male, and, he's going to drink a lot of alcohol, but it's absolutely not that at all. People come in with all different types of identities and all, races and creeds. And so, and the substance use disorders that they have too sometimes come in very differently too with opioids. And so, getting them connected to those clinics and I think is key as well. So fortunately, we're well positioned here with a lot of resources. University of Chicago has an addiction clinic that patients can be seen at, and we have a good relationship with the VA. And so I think that's really helpful. So I hope that answers your question.
Absolutely, it does. And there's a great irony there, right? Because many of it, as you said, it shouldn't be pathologized. It's a medical. It should be dealt with medically. And the very reason people turn to substances often is because they don't have access to other kinds of treatment, right? And that I heard a veteran once say that in the military's mind, treatment was like a stint on the psych ward. And so nobody is going to come forward and say, I'm dealing with these really difficult issues if they're afraid of that, right? And so they turn to these substances. And then that's the irony, right? It's that they need treatment.
I guess even to build on what you just said, we don't, patients with substance use disorders don't go to psychiatric hospitals. They stay in the regular hospital because they're medical issues.
Mm-hmm, mm-hmm. Absolutely. Yes, they should be. Okay, so I'm going to shift a little bit to talk about your opportunities after military service. How did you feel when you left the military? What was your transition into civilian life like?
So I was fortunate in that my career had, as like a military diplomat and a linguist, had prepared me well for a job outside the military. So I was very proud of the time or my service. But a little bit, as I mentioned, with leaving before Don't Ask, Don't Tell, felt like I had defended, so to speak, a country that wasn't really willing to defend me and my rights, which was always in the back of my mind and still is in the back of my mind when I think about transgender service members who aren't able to be open. And so that was always there. So it was I felt proud of my service, but with, a little bit of tarnish on there. And even still with talking to people about my service, I know that perhaps they're considering that. And, maybe that, they don't know that I'm, openly gay and think, oh, maybe I supported the ban. And so there was always that in the back of my mind. As far as the transition goes, the military, regardless of your sexual identity, does a good job, I think, usually helping to try to help people transition as far as their career goes. I'm not sure they're able to as effectively, help military, veterans, learn how to talk the talk of the civilian world, and walk the walk. It's very, they'll say, okay, here are the companies, you can work in if you're an electrician, or if you worked in transportation or the medical field, or you were an intelligence analyst or a diplomat, but helping get your resume set up so that civilians can understand it, and helping you not use all the acronyms. I think that there's still a lot of work to be done there. And I don't think it's necessarily all on the military side as well. I think sometimes the civilian side, it would be helpful to, have, companies, maybe reaching out on both sides to come in the middle. So it was a mixed bag, I guess is what I'm trying to say. I was proud of my service with a little bit of tarnished thoughts, and then looked to transition well, but then there were still some things that could have been improved.
Yeah. And your remarks remind me of one of the panelists from the Women in Boots event the other day, who talked about how difficult that transition was into civilian life, but also professionally, right? And I think she gave the example of her train was running late or something, and she texted her boss, and her boss said, "You don't have to do that." But military time was very, regimented. Okay. And you kind of hinted at this a little bit, but were any of your friendships that you had with people in the military, did they endure once you transitioned?
I wanted to bring this up earlier, so I'm really glad you're asking. In fact, I think a lot of them got closer once I didn't have the fear, being dishonorably discharged. Once I was able to sort of come out, so to speak, to, my battle buddies, and friends and former coworkers, suddenly we could talk about things that we couldn't before, and I know we both felt closer. So I would say my relationships improved. So if I had been able to be open, I would say I probably would have felt closer to them, and I bet a lot of fellow veterans in this group may have, who have a similar situation, may have felt the same. And so that was actually really wonderful in that respect. I would say also too, being able to be out and be open after I left was just, sort of a big weight off of my shoulders, and being able to be open now that I've rejoined is also a big weight off my shoulders. So I think that's some advancement that's been made, but hasn't been made for everyone. So the fight's still there for sure.
Yeah. I'm curious also about with your family of origin, right? I know that you're married now. You talked about that. And you talked about living openly now. And so I'm wondering if you're able to do that with your family, and sort of how that's impacted the relationship you have with your husband.
I look back at my time for my 9 years as enlisted as a linguist, doing intel, and working in Africa. I often imagine what I was thinking back in those times, because there was a little bit of desperation and hopelessness, like I'll never be able to have a family, I won't be able to have kids. And now the idea that I can be open with my husband, in my unit, and, talk freely with my coworkers really feels wonderful. And so I think, that's wonderful. He's happy for that. And I think we've talked many times about how, I don't know if we would have gotten married if that was the case. We probably would have kept, if the Don't Ask, Don't Tell had not been repealed. And so I think that's, to me, that's really wonderful. We met in DC afterwards when I was working there. And so, yeah.
Yeah. Did you say whether your husband was a veteran?
He's not a veteran. Yeah, he's not a veteran, but was interested. So I was volunteering in DC with a veterans organization and at a fire station. He was interested in, volunteering in DC, and had, reached out to me and said, "Hey, I saw you're volunteering at these organizations. I'm also interested in volunteering." And that's how we sort of, met and, kind of moved to this, next stage. So.
Nice. That's wonderful. All right. After your military service, what was your pathway into medicine?
So discharged in 2009, and then I worked I worked for 3 years in the State Department as a Foreign Service officer, doing cultural and education affairs. I loved it. I lived in China for 2 years, got to write a speech for Joe Biden when he visited, which I was very proud of. Lots of other bipartisan senators came to visit, and was able to sort of, be their press officers during those visits. And then I was able to do education and cultural exchanges like Fulbright. We brought athletes and musicians. So I really loved my job as a diplomat, which I felt my time enlisted as a linguist had prepared me for. Unfortunately, while I was in China, I had a close family member fall ill and unfortunately pass away. And I started to think, I need to be able to be closer to home. So I moved back to DC, got a job working for an intelligence agency, and started volunteering as an EMT, which I had mentioned just a moment ago, and to sort of explore. I'd always had an interest in medicine, had done some of the prep work in the past, but was on a different path through the military and the State Department. But I loved it. I worked at a clinic where I escorted patients who would go to treatments for depression, and I loved that. And I knew I was like, I want to be able to. I think in my blood I had this something the military had done to me, or maybe just something that I had as a person. Maybe other fellow veterans felt like that. Like, you feel good when you're serving other people, and so I got a taste of that again. And I had to have more. So I went back, I did a post-bac program in Maryland, in Baltimore, and then fortunately got accepted to medical school here, and I haven't looked back since. And I absolutely love being able to serve my community in Woodlawn and the surrounding area. So it's why I live south of the university, because it feels so good to be able to help the people, I saw my neighbor, I think 2 weeks ago in the emergency department when he was sick. And it was really, I think when I walked in the room and he knew that I was going to be taking care of him, I think we both just lit up, because we know, like, this is what I wanted, and and he felt so comfortable knowing that his neighbor across the street 3 doors was going to be taking the absolute best care he could of him. So
yeah, I had a similar experience to that before, and it does feel really good. Yeah, my former neighbor was a nurse, and my partner had to be in the hospital, and when we saw her walk in, it was a huge relief. So we've talked about several things that sort of marked your military experience, that translated well for your life outside and for you professionally as a physician. And it sounds like, based on what you just said, my next question was, which of those things were most significant in helping you to do your work as a physician? And it sounds like the ability to serve is
one of them, for sure.
Yes.
So there are some others too, absolutely. And I think a lot of people here on the call can probably agree, there are a few places in the civilian world where you can find and I said this word before, esprit de corps, that teamwork feeling that you get in the military, where you want to support the guy or the person to your left or right would support you. And so you want to support them. And I think having that sort of in my blood from those 9 years, helped when it came to being in the emergency room and in the hospital, because whether it was a nurse or a patient or a fellow consultant or an EMT that was walking in the door, I wanted to be part of that team that was all trying to support our community. And so I think that helped a lot. I think understanding hierarchies, a lot of us, whether we liked it or not, the military is very hierarchical. And so, knowing that when you're told to do something, like, you're going to question it a little bit, but then you're probably going to carry it out unless it's really nutso. Works well in medicine, and probably, like, I bet a lot of you have similar experiences in the corporate world, where being able to follow orders with a modicum of discretion is very helpful. I think a lot of veterans have a can-do attitude. It's like, oh man, this is not a great situation, but we're going to get through it together, and I'm going to get whatever get whatever done that needs to be done. And I think in medicine, that helps a lot. And a lot of, actually not just medicine, any career, someone who's willing to say, well, I know this isn't going to be great to do X, Y, or Z, but I'm going to do it for the team and for the ultimate goal, the quote unquote mission, I think is something that, has helped me a lot. And I mentioned the community. I think those are some of the main elements. There's probably a few others I'm forgetting that, I'm glad to hear someone else chime in later.
Yeah. And just, sitting here listening to you, I'm thinking about, yes, the teamwork, the work ethic, the discipline, right? And I think in terms of people being in the military, this might sound weird when I say it, but the ability to endure discomfort, right? Like that lends itself well to certain professions. Like, you don't get to eat at the time you plan to eat. You might not get a bathroom break, right? And so just the ability to power through those things, not that it should be a practice that happens every day, but the ability to power through, I think, is one of the things that I've heard people describe that they took from their military service that was really useful for them outside of the military.
Yep. And there's something else I want to add now that you just, when you were talking, that I want to, so I came from a small town in Western Colorado with not a lot of ethnic or religious or sexual diversity, frankly. And the military, I think, opened my eyes in a way that I can't really explain to my civilian counterparts. You know, it's a very diverse organization, and it's often led, sometimes 2 steps forward, 1 step back. But I think being exposed to people from all over the country who grew up in very different ways really opened my eyes in a way that probably I wouldn't have if I had just gone to, you know, a regular university instead of, you know, the military.
Yes, yes. And not only the presence of those other people, but the way that the military functions. If you are, you know, in the trenches, I guess you could say, or you know, and you need to work as a team, you don't have the option to not do that, based on the fact that you don't feel connected to or identify with other people.
Everybody gets to suffer the same usually.
Yeah. Okay, so given your, and you know, I want to talk a little bit about OMAC because everybody sings the praises of OMAC. And of Terrell specifically, he does such an amazing job leading that unit. And just given your status as a student veteran, as an alum, as now a medical resident, how would you describe your interactions with OMAC? And if given the chance to make changes to services for veterans and their families, what would you change and how or why?
So I agree with what you said. I'm unabashedly have a positive opinion of OMAC. I think it sort of came into existence during my sort of towards the end of my 3rd year of medical school, and I was very eager to engage. I know there were organizations throughout the campus, especially at Booth, that had vibrant veteran support, and OMAC has done nothing but connect the dots among all the people who were trying to do the same work. And which I think is one of its greatest strengths. I know we talked a little bit about intellectual support and financial support, but I think the social support has been tremendous, and where we've made a lot of the greatest strides up to this point, which is why I have, you know, only positive things to say. Beyond that, also, I feel like OMAC isn't just invested in our veterans, it's invested in the community as a whole and helping them understand veterans better. They care about, I mean, the university committee or community specifically, but also the local community, because there are veterans in that community outside of the university too. So there've been a few events that, you know, have sought to involve the community, which, so I can't say enough good things about OMAC. And I if I were to offer constructive criticism, I would say that I wish they could have come 3 years earlier when I first got to University of Chicago, because I can only, in fact, I have spoken with medical student veterans who have arrived on campus, and they have felt that the outreach from OMAC has been tremendous and have really helped smooth their transition. And not that I had a rough transition as a student, but yeah, I think that would have been really wonderful to be, you know, inaugurated in to the military community as well as the, you know, the medical school community that way. We touched on it earlier, the social, the financial, intellectual support systems. And I really think the greatest work has been done in the social arena. And I would say that the greatest work to be done is in the financial support of the veterans, both as a nation and, you know, as a university. So making sure that, you know, the veterans who have, you know, served their country for however many years, you know, have access to the resources that are going to continue to make them successful.
Yes, yes, thank you. And speaking of constructive criticism, what advice would you have for the military, for the leadership of the military? And I'm asking this question because often when we talk about creating access and we talk about supporting, we focus on the marginalized, right? And so what we know is that the people who have the power to actually enact those changes and provide those resources are the privileged. And so what advice would you have for them?
So I do have a couple of, you know, close contacts who still work in the military, but I think they have a lot to learn from, especially the medical field and, you know, civil society, as far as not just inclusion, but, you know, making sure that there are women and people of color in positions where they can promote inclusion. Frankly, I think the military, I think it was just the other day that there was I can't remember if the first, what type of unit she was the first brigade commander of, but, you know, it's the fact that in this day and age, you know, in 2020, that we're still seeing first in those ways is wonderful, but I want to see more of them and I want to see them faster. I think that encourages a lot of people. Also, I think the military, you know, there's been, I mean, the federal government still struggles with this too, but the type of diversity and inclusion training that we get in the private sector, the federal government recently hasn't been doing those sorts of things. And I think that's really important. And I think there's a lot of work. Frankly, I didn't learn what I know now about sexual identity until after I'd left the military. And I think, there's the military does a lot of training on things that, soldiers probably don't want, as far as, sexually transmitted disease and, abuse, spousal abuse and domestic partner abuse and a lot of things. And I think when it comes to sexual identity, there's a lot of room for education there that is definitely not happening at this point because of the ban.
And the diversity and inclusion training, we're seeing the backlash to that just across society. But I think I mentioned this the other day, we have an executive order like from the administration that really discourages that. Yeah. And so I would imagine that's another obstacle.
Yep, that's what I was referring to specifically.
Yes, absolutely. Let's see, I just have a couple more questions for you. And one has to do with the charitable work that you do. I know that acts of service are very important to you. And so what kinds of charitable work do you do?
So I like to, I feel this is weird. I'll be brief. So I've always felt it's important, growing up, my parents instilled in me that, whatever you're doing professionally, you always have to be volunteering in some sort of way. And so, as a kid, just working at the SPCA I volunteered as a big brother when I was in the military. And now my charitable work focuses primarily on the free clinics that we have in Chicago that are through the University of Chicago. There's two, one in Bridgeport, which is primarily focused on the Chinese immigrant community. And since I have learned Chinese in the military, I'm applying that skill with the medicine that I've learned at University of Chicago. And then I'm really proud to be part of my, my neighborhood block club, which runs a lot of events. We have medical screenings that we do. There are social events that just bring together the people on our block. And so helping to organize all of that really with actually Dr. Iris Romero, who is the BSD's diversity and inclusion director. She just lives like 4 doors down from me. So working with her every day on our street to sort of foster that, friendly and inclusive environment is so wonderful through all the events we do. And she's really inspired me in a lot of those things too. And I've never lived on a friendlier street in my whole life. So I won't belabor those volunteer, because I could, and I don't want to do that for you guys. Thank you though.
Yes, thank you. Well, speaking of diversity and inclusion, I know that Maris and her team conducted a needs assessment study. Do you have any thoughts about any of the outcomes from the study?
Yeah, I think I remember being interviewed for that needs assessment. I recognize my interviewer in the pictures, and I remember I actually saw a lot of the results in the report that Maris gave. So I really appreciated seeing sort of that on the other side. Like I said, the thoughts that I would repeat again is like so much progress has been made in connecting the different parts of the campus, and we can continue to do that. The School of Social Service, Booth, all the graduate programs. And I think continuing to link those groups together will be great, and helping getting us invested in the community and the veterans in our community as well. And then, like I said, I'm not trying to harp on this, but the financial aspect, I think, really would help a lot of veterans, I think, in the community too. And so I'm sure there are people out there who are thinking like, oh, how am I going to finish my second year of this, this master's degree? And I think it would be helpful to have OMAC be sort of on their side in those ways. And I know they are already. So, but maybe with some ammunition.
Yes. Dr. Bowman, is there anything else you'd like us to know?
You know what? I know that this has been focused on me a lot, and I'm looking at the faces here on the Zoom, and I just want to express how honored I am that you guys all came today, and how, I think blessed we all are to have a supportive community, even if we have never met before. And if you guys ever, need anything, please feel free to reach out to me. And yeah, I think that's all I'd like to add to what's been said today.
Thank you so much. So that is the end of this segment of the program, and I'm going to turn it back over to Morgan, I believe, for our closing. Thank you, Dr. Bowman. Thank you, everyone.
Thank you.
I would also like to say on behalf of everyone else here, thank you very much, Dr. Bowman. Thank you very much, Ms. Sides, for your insight, for your experience, and just for being here today. It's greatly appreciated, and we all benefited from this experience. So I'd also like to express my thanks to the EOP, the Diversity Inclusion Studio, iHouse, and of course OMAC for embodying inclusion and affording our heroes the opportunity to share with us and to help the community at large so that we can all better understand each other and build a stronger U Chicago. Thank you for all the participants, for the support of the military affiliated community is really appreciated. And with that, thank you and enjoy your day.
And I neglected to ask if there was anyone who had questions for Dr. Bowman, if there's anyone who has a question. We do have more time. And so please either pop your question in the chat or just unmute yourself and ask.
Okay, I'll jump in. Can you hear me?
Yeah.
Thank you both so much for that conversation. It was just really helpful to hear tangible experiences from the past and from today. And I'm curious, you know, you mentioned, I think, Vicki, there's policy and then there's sort of the reality. It takes time for things to, for policy to be implemented or for people to experience the benefits of that policy. And Dr. Bowman, I'm wondering if there if you have any recommendations for people from the community who are working with people who are, you know, underrepresented or who are maybe part of a group where policy may have changed, but experiences in whatever group or culture they're in may not feel like they have changed with the policy. And if there's anything that you experienced that was helpful from people around you to make that transition more smooth.
So I think the first thing that comes to mind is the squeaky wheel gets greased. And I know a lot of veterans are used to, you know, hey, this is a tough situation. I'm just gonna deal with it. Oh, things are changing. I'll kind of wait for things to change. I don't know if a lot of you have that same experience, but that's a feeling I've had in a couple of places. And I think the piece of advice I would give is, you know, be the squeaky wheel. You know, if there's a policy in place that stands for justice, and then I think it's worth, drawing to the attention of those who are in positions of power. Hey, this policy isn't being carried out in a way that, is promoting justice. And pointing it out again and again, because I think, if we know anything from our time in the military that, whenever anything wrong is done, we got to have it documented. I don't know, we've probably all been counseled at one time or another for minor and major offenses. And so I think making sure that those, small slights or large slights that are against policy are documented is so important. As a physician, that's for sure one of the things that I do a lot. And I know we all experience that in the military. And I know that seems small, but I think those things add up. When policymakers go looking for evidence and they see, wow, this policy really isn't being enforced, or, the effects we were hoping for with this policy change are not materializing. This subpar status quo still exists. And I think that's really a great way that we on the, at the grassroots can affect change. And I encourage anyone on here who, lives at the grassroots like me to go seek out, getting out of the grassroots and organize and do something like that. I think that's another great way.
Thank you.
Yeah, and can I add to that the people who are in positions to have some kind of impact, to start having those conversations, even if it takes a while for it to come to fruition. And this might seem unorthodox, but I just want to acknowledge Anissa Ali, who's on the call, with whom I had a conversation, I don't even know how many years ago. And she sort of foretold the need for institutions like ours to support veterans and to provide resources for services for them. And so I won't forget that conversation. Anissa, it's great to see you here, but big ups to her, because she was the person who started those conversations many years ago for, the fruits of what we see now.
Thanks for that curveball, Vicki. It's so like you. I thought I was here on the, you'll appreciate this. I thought I was here on the down low. It just warms my heart to see this, and the scope that Terrell has brought to it. It also warmed my heart because I think of my brother who was in the Navy before, don't ask, don't tell, and was discharged with less than honorable discharge. And you know, his life was rocky, and he was young when he passed, and we miss him dearly. The hearing about the role of family, about how interconnected we are, and these aspects of identity still point back to our humanity. And all we have to do is open up and be willing to listen, and can really, so much of what I hear and what I've heard all week. I'm also from a military family, but haven't served directly, but it just resonates, hits home, and greatly, and no more so than right now. So this is the time for us to be having these conversations and taking this good advice that we're getting. So thank you. And I'm gonna get you for this.
Thank you. Is there anyone else who has a question or a comment?
I was waiting to see if there was anybody else, Vicki, but I definitely have a comment for Dr. B. So when I met Dr. Bowman last year, and I would use him as an example to all the law school students, the Booth students, the Harris students, and every other student that we had. Whenever we did programming, you know, I get some students tell Terry, I'm really busy. And of course, the academics come first. But every single program that we hosted, Dr. Bowman, or then student Bowman, was there. Whether he was on his way to the hospital or just leaving the hospital. So of course he never could really sit down and have beverages with us. So he'd always have his water. He said, oh, I'm just gonna drink water. I'm going to the gym, or I'm going directly to work, or directly after. And I would always use him as an example as somebody that's completely supportive of this community. I told Mitchell, I believe I just told Belinda in the chat, I said, he is a great person. I mean, not just a veteran, but a great person. He's extremely genuine in his approach. And I know people tell me that all the time. I said, but no, there's so many people out here much better than me. And Dr. Bowman is one of those people because he embodies exactly what he's saying. So when I spoke with him about doing this particular program, you know, he was overly excited. He said, Terrell, I'm going to call off work right now. I think it was, what, 2-3 months ago? We put the date in. So thank you so much, Dr. B, for all that you do, what you're still doing in the community, and what you're going to do later on for everybody in the world.
Takes a village, right?
And thank you to all our veterans. Thank you for your service.
But if there's no one else, again, Dr. B just got off again, and he's here after work, everybody. He worked last night in the emergency room. So he is so gracious enough to be here with us today for all this time. So if nobody else has any other questions or comments for Dr. Bowman, or for Vicki, or for Brad, who's actually still on the call as well, we'll definitely go ahead and close out the program. And again, thanks to you, Chicago. I believe I saw.
Sorry. Yeah. No, I'm Thad Bridberg. I work at Rush in a veterans program here, the Road Home program. And I'm sorry I'm arriving late. I was doing some clinical work that carried over. We have a veteran who is a social work intern at University of Chicago, John Hojak, who I think is speaking at another thing tomorrow, who clued all of us into this week of these workshops. And I was really excited to see this one. So I regret being late. But I just want to say the Road Home program has done some really good training and work with all of our clinicians and staff to not only do the work we do, which is essentially treating PTSD in post 9/11 veterans, but some real important training around the issues of inclusion and diversity. And we have a subcommittee that has really pushed us to do more training and more policy work. So I just want to share that with you because I know that we can do our best to meet the needs of veterans within this community, and we can see them outpatient and through our intensive program. And currently, I'm working with a transgender individual who I'll just say that I learned the most from actually doing the direct clinical work with this population. And so we're building our experience, and we look forward to continuing to work with all veterans, regardless of their diversity. And thanks for having this. I think it's a really important topic.
Thank you, Dad. Thank you, Thad. Firm support of your program. Will, I've known for years. Will actually sits on the not-for-profit with Dr. Bowman and myself.
Right.
So firm believer in your program. Tuesday, I had on your shirt during our Honor the Hurt event, shirt that I got from Will. But we definitely want to partner with Rush and everywhere else to support not just veterans with mental health conditions or veterans who are dealing with identity issues, but all veterans as well as their family members. And during our symposium, we spoke extremely highly about the program that you guys have in regards to services for military families, which are free of charge, not just to families, but you could be your roommate, it could be your cousin. So that's definitely a model that we are looking at. And I believe I have a call set with Will here pretty soon. So, but love the work that you guys have over there. Is there anyone else that has any questions or comments? Thank you again, Dr. B. I'll be texting you. Thank you again, Ms. Vicky. I'll be knocking on your door. Maris, I'll see you when we're back on campus. Brad, thank you so much for your contribution about the LGBTQ network for the University of Chicago. Thank you for all of our attendees for joining today's discussion. Again, this is one of much importance. And I definitely want to thank our MC for today, Morgan, who's been cramming with me to get this done. Looking forward to the great work we're going to do with him over as a graduate fellow at International House. So thank you all.
Thank you. Thank you, everyone.